Yes, I would move Senate File 393. This is personal care assistance program modifications. In a nutshell, and I'll let the witnesses give a more detailed discussion of it, what we are trying to do here is we're dealing with the area of complex personal care assistants who deal with people who have severe disabilities and require care a good part of the day, and in some cases even longer than that. And this care is provided to help these people live a more normal life, to stay in the community more rather than being warehoused or put somewhere. So it's a very important bill in terms of quality of life and the need that these people need for personal care assistants that are more highly trained and are more highly compensated because of that. And what this bill basically does is expands the number of residents or people who would be qualified to receive this care based on that complex calculation. And for that, I think I will just turn it over to Jeff Branksberg to have him testify.
Senator Ralph, there's an amendment that...
Oh, I'm sorry, yes, there is.
And just, a person can put the bill in the first committee or first hearing. A person can put the bill in the order that they would like. Secondary committee subsequent to that, really, they should be explained and understood well. But can you explain, just for my benefit, in brief, what your amendment does, and then we can move to adopt it.
Changes.
Mr. Branksberg, do you want to comment?
Yeah, it's primarily a technical amendment, Mr. Chair.
Okay.
And let me see if I can find the actual copy here. I had it, and it disappeared. I'm sorry.
I can speak.
Yes, I have it. Thank you. Basically, it says that the person, instead of successfully completing training, it asserts it is qualified to provide the care and assistance. So it's a technical, and then it also increases the rate at 120% of the rate paid to a regular personal care assistant. So those are the amendments.
Yeah. And I guess I'd speak in favor. I'd rather have a person qualified than having been successfully gone through a course.
Right.
Senator Ralph moves the A1 amendment. Any discussion about that? Seeing none, all those in favor say aye. 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 Opposed. The amendment is adopted in the order you'd like. So let's go to your testifiers, Senator Ralph.
Yeah. Mr. Chair, members of the committee, my name is Jeff Bangsberg, and I'm a retired old advocate working on behalf of this issue for people with disabilities with high-level needs.
Is that as close as, we have a microphone for you.
Oh,
Maybe
okay.
Jerry, you can hold that for whatever.
I can hold that.
Thank you.
Is
We don't
it
want to
on?
miss you.
Got to turn on? Hopefully we won't get feedback.
There we go.
Thank you. Again, my name is Jeff Bangsberg, and I'm an old retired advocate, as they say, who came back to the legislature to work on this issue. In part because I lost two dear friends of mine this last summer, in part because of the severe staff shortage that we have. They are also individuals who needed a significant amount of care and probably would benefit by having individuals that were a little bit more trained in the field. And we're finding out that those with most complex needs have the hardest time finding qualified and capable staff. And we realize that PCAs receive the same amount of pay no matter who you're caring for under the program. Although we do recognize and we do support all PCAs that are working in the entire community, and we feel that they all deserve a raise. Our specific issue has to do with those that require 10 or hours more of care. Back in the old day when I was on the PCA program, and I'm fortunate that I got off of medical assistance 20 years ago, I required 9 hours. If that gives you kind of an idea, I can hold on to things with a little bit of help, and then I can feed myself, I can drive. Other people are a little bit higher level and cannot. But the crisis has gotten really huge for people with disabilities, and the testifiers will speak to that case. What I would like to point out specifically in this situation is that, again, we're asking for a complex level of PCA service, which requires a particular level of training and is reimbursed at a specific rate. In the 40 years that this program has been around, since 1976, 77, the PCA program has never had a rate differential. And I think it's probably overdue in order to provide care for those with the highest needs to have some criteria of training and then to pay those wages differently accordingly. And I'll take any questions if anybody has. Thank you.
I think we'll do testimony and then we'll take questions.
Thank you.
Ms. Fries, is that?
Mr. Chair, members of the committee, my name is Carla Fries. I'm 52 years old, and at the age of 16, I acquired a spinal cord injury, leaving me paralyzed from my shoulders down. I have received PCA services for 36 years, and I currently qualify for 12 hours per day of PCA services. I need total assistance for all my cares. I cannot feed myself or open doors. I can't drive. I'm diabetic. I use a BiPAP machine at night. I have wound care issues. My cares are complex. Before moving to Hopkins, I lived in rural Minnesota for 15 years. Disability issues such as PCA staffing can be more extreme in those areas due to lack of resources, isolation, and even pride. If urban areas are experiencing difficulties, it is likely to be even more critical in greater Minnesota. Upon moving to Hopkins, I was employed as a staffing coordinator at a home care agency for 12 years. I've observed that as the economy and the job market improves, it becomes harder to find qualified caregivers. Those of us with disabilities find ourselves compromising our health and well-being to accommodate caregivers. I've allowed PCAs to bring their children, to be late, be on their phone, and let my cares be shortened in order to have any caregiver at all. Consequently, we end up burning out our faithful, reliable workers just trying to function. I cannot hold a full-time job, catch Metro Mobility rides, or participate in my community if I do not have reliable caregivers to get me in and out of bed every day. It's disheartening to hear that fast food workers are being paid better than my caregivers. For example, my full-time caregiver has 30 years of experience and is paid $11.27 an hour. Her salary has only increased 77 cents in the last 10 years. Most are not paid PTO, holiday pay, and have minimal benefits. PCAs only receive raises when the home care agencies get a reimbursement increase. I live in a handicap apartment building. Half of the tenants receive PCA services. In the past holidays, which happened to be on weekends, proved to be a staffing challenge, and many managed on minimal care. A neighbor told me that she has spent many weekends in bed due to the lack of PCAs. She was told that she may have to go to the ER to be admitted to the hospital over Christmas due to the lack of her PCAs not being available. The scenario was avoided, but that option horrified me. And recently myself, it took me 5 months to replace a PCA I had to let go for stealing. Many of us in the disability community find the current staffing shortages very stressful. Some are feeling depressed and helpless about their situations and are fearful of the future. Lastly, if this crisis is overlooked and the legislature hesitates to act, the consequences could be catastrophic for vulnerable Minnesotans with disabilities. So I urge you to respond quickly. Thank you for your time and for listening to my story. Do you have any questions for me?
Thank you, Ms. Fries. hang around a little bit. I really appreciate you coming in today. I just really appreciate you being here. So, is Mr. Banya going to be testifying as well? Okay.
So here.
You can just stay there, Ms. Freeze, if you like, and Mr. Banya can just park on or whatever. Okay. Because we have a portable microphone. And while he's getting set up, we had a text comment from Mr. Felling, who's in a similar situation and very challenged, and he wishes he could be here, and he just echoes what people are saying. So I'm not sure if you've ever had a text witness before, but it's modern technology. Mr. Banya, welcome to the committee.
Thank you, Mr. Chair and committee members. My name is Don Banya from Rogers. On August 19th, 1970, I was thrown into the unwanted world of a quadriplegic when a hit-and-run drunk driver pulled into my lane while out enjoying a motorcycle ride around Lake Calhoun. Subsequently, breaking my neck, leaving me paralyzed from the shoulders down. Within seconds, I went from being an active, high-spirited teenager to having to rely on others to do everything from being fed, bathed, dressed, and everything in between. Currently, my primary helper is very good in helping me in all my needs 24/7. However, I've been having a lot of difficulty finding someone to replace her, not to replace her, but just to give her a break. However, with the minimal pay that's available, this has been very difficult to do. I also have a very good friend of mine, a disabled friend that I've known for decades, who lives in Detroit Lakes. He is allotted 22 hours per day, but rarely sees these hours filled simply because of the incompetence in many of the PCA workers. And if it was not for his 83-year-old mother who lives down the hall from him, my friend David would probably not be here today. Not so fortunate was my friend Mike, who just last September lost his life simply because he also was having a difficult time with staff. He was bedridden for 15 months, all because he lacked a good, consistent attendant. They're just not out there, and I truly believe that the PCA program today is in crisis. So in closing, the PCA program, when it was first introduced, was in 1978, where I qualified for 14 hours of service a day, when it was easy to find a college student wanting to make some extra cash. However, now with the change of state regulations, my PCA hours have been reduced to 11, which would disqualify me to receive the complex care rate under the governor's order. That's why I urge you to support Senate File 393 that would allow people like me to obtain the enhanced rule for competent PCAs. Thank you for your time.
Thank you, Mr. Banya. And one more testifier is Mr. Varco, or looks like the in lieu of guy. Senator Ralph, you just want to move, let him sit where you are, and we'll let everybody else to stay seated there. Or we, okay, if you could just kind of, yeah, okay. Senator Ralph, you can sit down. I guess we're not to the Mr. Varco part yet.
Hello, my name is Jim Carlisle.
Hello, my name is Jim Carlisle. Philip's going to help me. So these are Jim's prepared comments. Chair Abler and members of the committee, my name is Jim Carlisle. As clients in the state's programs, my wife and I have both relied on home care workers every day for more than 40 years. I am a public accountant. I'm very proud to have served as a member of the SEIU Healthcare Minnesota bargaining team, together with consumer-directed home care workers, that negotiated with the state from last fall through early this year. SEIU Healthcare Minnesota represents over 40,000 healthcare workers in the state, including 27,000 home care workers in consumer-directed programs who serve people like me. On their behalf, as a leader of the union's bargaining committee, I encourage you to support Senate File 393. Thank you, and thank you, Senator Ralph, for bringing this vitally important issue forward. Minnesota faces a dire workforce shortage in home care. For those of us who live it every day, it is truly a crisis. Far too many elderly and disabled are simply unable to get the care we need right now. Worse, clients with the most challenging needs face greater barriers to finding qualified and responsible home care workers. When we don't get reliable care, the consequences are more costly and severe for the state. In particular, those with complex care needs need to be able to offer wages sufficient to retain PCAs who have learned over time to provide the challenging care that they need. Some complex situations where breathing issues are involved call for a constant supervision by highly trained and dedicated caregivers who are literally life-saving. Senate File 393 would help to compensate these hard-to-find healthcare workers by creating a 20% higher reimbursement rate for those who require 10 or more hours of critical care per day. This would allow those with the most complex care needs to offer higher wages and to attract and retain better qualified, and more reliable care. Because SEIU Healthcare Minnesota home care workers have recognized this important need in our client community, the tentative agreement we reached with the state in early January, after months of hard negotiations, includes a similar, though more modest, provision. We urge you to support Senate File 393. Thank you for your time and consideration of these important issues.
Thank you, Mr. Carlisle. And were you speaking in lieu of Mr. Varco, or is he still coming?
Yes.
Okay, thank you.
Thank you, Mr. Chair.
Next time, send him instead of Mr. Varco, will you? That was really compelling. Tell him I said that. Anyway, so you've, Senator Ralph, I guess members, do you have questions or comments? Oh, you have some information about the general cost, although it's not a fiscal note, right? Senator
Right.
Ralph?
The basic,
Mr. Bangsberg.
Mr. Chair, Jeff Bangsberg, the numbers really, oh, turn it on. There we go. In regards to the governor's settlement with the SEIU union, in his budget is included a complex care rate of 12 hours or more, and that affects about 550 individuals. And the similar proposal that we have that binds a little bit more of the language to include training to a certain level is about 2,900 people. So it's quite a few more, but we really believe that the 10-hour threshold is probably more appropriate than the 12-hour threshold. But I would assume that the governor was unable to find that in the budget. So,
Mr. Bangsberg, so how many people were in the governor's proposal? 1,000, or do you have an idea about how many were in that?
well, 550 for the complex care piece. They have a proposal, I believe, for a rate increase in year one for everybody, all the PCAs, but they did do a complex PCA increase of only 10%. For only 12 hours or more, and that's 550 people versus 2,900 people.
I appreciate that.
Thank you.
Members? Senator Klein.
Thank you, Mr. Chair. You mentioned that your personal care attendant receives $11.27 per hour after 30 years of service. Can you give me a feeling for the starting wage for a personal care attendant?
Is that for Ms. Freese? Ms. Freese.
It kind of varies by agency, but starting wage for my agency would be $10.50. And if I bring them in, it's $11.50. So this person that started at $10.50 and now receives $11.27.
Senator Klein.
And I do have traditional PCA services, not the choice program.
Thank you,
Senator
Ms.
Klein.
Freese. Thank you, Mr. Chair.
Seeing no, do you want to make a final comment before we just lay this bill over? Senator Ralph. Thank you very much to the testifiers. It's extremely compelling.
Well, I think the testifiers have presented the information very well. We have a crisis, and everyone knows that we need people to serve the highest vulnerability, the people with the highest needs. This is a modest increase request, and unfortunately, without the fiscal notes, I understand that it's difficult to proceed. So at this point, I would assume that we would want to lay this over until we receive the fiscal notes.
That's right. Okay, seeing now more to Senator Lordy.
I mean, we could do that, Mr. Chair, we could do that. I mean, I'm not quite sure, but what we had done previously in policy committees was a motion to pass as we're convened as a policy committee, and I'm okay with that, but then to refer to finance, I don't know if this is a finance committee.
It is.
Or if we reconvened, I mean,
No.
I'm working through this with you is what I'm
Okay,
doing
well, last
here.
year, if you recall, higher ed was 2 committees. There was a policy and a
Yep.
finance. We're just one happy committee with intermingling and commingling and all that, which is probably the confusion. Just if the bill is merely laid over, that's sufficient. And so if it were brought up and attempt to be moved without us working on the money, then you would have a good reason to object. And-
Well,
But that's my intention, we'll just lay it over, and then it'll sit here until we get the fiscal note and decide to take the time up to reconsider the fiscal impact.
But I'm not, Mr. Chair, I'm not
Senator Lewis.
objecting so much as trying to help make sure that we all, know what's happening. I mean, we have one coming up on the agenda that's got a dual jurisdiction between
Right.
yourself and Senator Benson. So if we lay that one on the table here, then it might hang it up in terms of Senator Benson being able to hear it.
That'd make a lot of-
If we actually take a positive action and pass it on to finance committees, then it again, it's up to you. I'm
Yeah.
okay leaving it on the table. This one here should, will come back here for the finance discussion, but not all of them are similarly situated. And so I'm literally not trying to be
Yeah.
a pain,
Senator
not trying
Laurie, to your,
to object, just trying to make sure that we have a set of rules that we can all play by that actually work.
Well, there's different levels of motions. There's laying over possible inclusion. We're not to that point yet. That's a point that it's just being laid over as though we're taking a break. And in terms of the second bill that we're talking about, dual jurisdiction, some people would be happy if it didn't have time to get to Senator Benson's committee. So anyway, so with that, this bill is laid over.